Hi, my name is Chandler Melton, and today I'll be talking about the four sets of costs that the politics of health insurance began to revolve around. The four sets of costs are individual losses of income, individual medical cost, the indirect cost of illness to society, and the social cost of medical care. These costs dictated the rise of reformers with different interests. Politics became concerned with health insurance around the late 1800s concerning the financial cost of sickness to the individual. Countries such as Denmark and Sweden began to provide aid for loss of income and sickness insurance. The U.S. did not do so at this time. Health insurance's original function was to stabilize incomes, not pay for medical costs. Social insurance proponents in other countries such as Lloyd George also recognized the impact that sickness had on the productivity of society. He coined the phrase, "You cannot maintain an A1 empire with a C3 population." There was widespread awareness among workers of the value of insuring against the cost of sickness. There was little commercial health insurance available at this time, but Americans did spend money on life insurance. The American Association of Labor legislation proposed a bill for health insurance saying it would relieve poverty caused by sickness and would reduce the total cost of illness and insurance to society. The American Federation of Labor opposed the program, and American businesses rejected the argument that health insurance would add to productive efficiency. The insurance industry feared a loss of profits by creating compulsory health insurance. Doctors themselves rejected it, and with entry into World War I, this movement ended. As the 30s came about, there was a shift to focus on the medical costs to individuals. Medical costs began to greatly outweigh earnings lost from sickness. There was also great variation in the cost. The Committee on the Cost of Medical Care performed research and published reports on medical care in America. The system of welfare payment for medical care was started during the Great Depression but was supposed to be temporary. It would continue on much longer than this. Reformers tried to convince doctors that health insurance would help to solidify their earnings during this time. The National Health Conference was called, and it began another movement for compulsory health insurance that also failed as the New Deal in World War II approached. President Truman's plan also does not pass, and it begins to be clear that America will have a system of private insurance for those that can afford it and public welfare services for the poor. Employers do not want the extra cost of providing health insurance. As we progress more towards the present, the idea of the social cost of medical care dominates much of politics today. This is the entire cost to society of such a medical program. Many conservatives and Democrats argue over whether privatized care or more socialized medical care for all is the most efficient plan for the U.S. As time progresses, these four costs have been considered in different ways to drive the need for health insurance and possible compulsory health insurance. In conclusion, insurance advocates initially emphasized the importance of the risk of lost income and loss of productive efficiency. This was followed by rising medical costs, which drew much attention. More recently, reform has been concentrated on the burden of rising medical costs on society. I would like to leave you with this question. Do you think the United States healthcare system will trend back towards the direction of privatized medical care or more towards the direction of socialized medical care in the next decade?